Wig. Really appreciate everybody's time and joining us today. We've got a great presentation for you. Just a couple quick housekeeping items. We will be recording today's session, so if you aren't able to join us for the entire time, or if you'd like to share the presentation later, we will have it up on our YouTube channel later this week. Just a heads up, if you are very, very interested in the presentation, it will be archived. Also, if you'd like to ask questions during the presentation, you can use the chat or Q&A functions. You access those by hovering your mouse either at the top or the bottom of the screen, depending on which view mode you're in. And I will act as moderator during the presentation to give Christina a heads up that the questions have come in, so she doesn't have to keep an eye on it. We will also have a little time at the end if anybody would like to ask verbal questions. We can unmute your line and you can indicate that you'd like to ask a question, again, by using the Q&A or chat, or there's also a raise hand function that will let us know you have a question you'd like to ask. But without further ado, I'll go ahead and turn it over to our presenter today, Christina Hunter-Mullis.
Thank you. Hi, everyone. Thanks for having me here today. I'm excited to talk a little bit more about a project that I have been working on with my advisor. So I am a second-year PhD student at the IU School of Public Health in Bloomington, and my advisor is Dr. John Macy, and we are going to talk a little bit about the implementation of an intervention to reduce prenatal smoking in Southern Indiana. So, just a few learning objectives to start out with. I'll talk about a few different areas, some of them just showing what information we had in terms of a needs assessment and the need for an intervention in the area that we are implementing this intervention. And I will also talk a little bit more about the steps that we're taking to actually implement the financial-based incentive intervention. And then also we'll talk a little bit more about some of the results that we're starting to see from that being implemented actually in clinics. So just to get started with a little bit of a background here, prenatal smoking is just in general a major public health issue. And we know that cigarette smoking during pregnancy is associated with a lot of different negative outcomes. And that can include anything from pregnancy complications, premature birth, sudden infant death syndrome, and also potential negative outcomes to the mother as well. In addition, cigarette smoking and pregnancy can also lead to elevated healthcare costs. And a problem that we're seeing is that the quit rate during pregnancy in the US has only been estimated to be about 55%. So there is a need here for us to try and implement some innovative interventions and different kind of strategies to help address that and get that quit rate up higher. Specifically in Southern Indiana, I wanted to just give a little bit of a comparison here. So the prenatal smoking rate in Indiana as a whole is about 13.5%, but we actually see some much bigger numbers when we look at the counties that our intervention is focused in, which is Orange and Crawford counties. So in Orange County, the prenatal smoking rate is 23.6%, and in Crawford County is a little bit higher than 30%. So that's much higher than the state average and shows additional need for cessation interventions in rural areas. And to talk to a little bit more about the intervention itself, we use the term contingency management for this intervention. Basically, this is financially incentivizing women to quit smoking during their pregnancy. And there has been research done on this previously, different trials using voucher-based management strategies and other types of financial incentives. And they're really showing that they can be successful in increasing cessation rates and just improving overall health outcomes. And I think that's one thing to keep in mind with this. It's not only do we want the tobacco cessation, but we also want to see that extended to creating healthier outcomes for the mom and the baby as well. So one thing about this particular intervention, this is a very collaborative intervention, a partnership between the IU School of Public Health and Southern Indiana Community Healthcare. So you can see the map here on the right-hand side. Those are the 6 clinics that Southern Indiana Community Healthcare has, or they have a presence at in Southern Indiana. So you can see Paoli, West Baden, English, Marengo, Salem, and Shoals. We typically work with the group that's based in Paoli, but this intervention is offered to women who smoke throughout all of these potential clinics. And so really the overall goal here, this was a 2-year project that's funded through the IU Center for Rural Engagement. And our aim is to reduce prenatal smoking, specifically in Orange and Crawford counties. That has been expanded a little bit with the additional locations from Southern Indiana Community Healthcare, expanding into Shoals and Salem area. But our original intervention was focused in Orange and Crawford counties. And the study also wants to test the effects of providing financial incentives for women who stop smoking during their pregnancy and also throughout the first year of the baby's life. So we extended this from not just prenatal smoking, but also to being able to follow these women for the year after their baby is born as well. And so just a general flow of how the intervention kind of works. So the women are recruited during their initial visit to confirm pregnancy. So when they go to one of the Southern Indiana Community Healthcare clinics and this initial visit to confirm their pregnancy, this is when they would be recruited and asked if they are interested in the study. If they are interested in the study, we would then take the steps to give them do informed consent with them, a HIPAA waiver, do a baseline survey, and then also initial carbon monoxide reading. So how we do that, staff at the clinic have been provided with smokelizers, and they are a product that the mom can blow into, and that will read the carbon monoxide level. And so we will get an initial carbon monoxide level reading during their enrollment. And that's kind of used as their baseline. And after that, we then follow these women throughout their pregnancy, and the intervention of getting that carbon monoxide reading with the smokalizer and also the completion of a short survey occurs at all of their following prenatal appointments. And so that's one thing that we really wanted to focus on, is that we wanted to make this as easy as possible for our partners over at the clinic who are implementing this intervention by just adding it onto appointments that these women are already coming for. So at those prenatal appointments, there could be up to 12 for those women. And after that, we also continue, like I mentioned, this intervention to the first year of the baby's life. And so this intervention is also offered at the newborn and well baby visits after the baby is born. So that could be up to 7 during the baby's first year of life. So a total of up to 19 different appointments where we are offering this intervention and following these women throughout the study. Where the incentives come into play, there are a couple different areas. So one area is every time they're filling out the 3 kind of longer surveys that we have, the first one being the baseline survey when they are enrolled, a newborn survey for the first meeting, for the first appointment after the baby is born. Then we're able to see how their attitudes and behaviors towards smoking have changed since or during their pregnancy. And then we also do an end of study survey, where we can then see how those attitudes and behaviors have changed during the baby's first year of life. And so they get a $25 gift card just for completing those surveys. But with the intervention itself, that carbon monoxide reading that we get at every appointment, participants could also receive a $25 gift card at a visit if their carbon monoxide level is a lower number than their previous visit. So it would have to be lower than what they had the last time that they were in for an appointment. And if it is, they get a $25 gift card. We offer two different kinds of gift cards right now, one being a marathon card and a CVS gift card. We found that when we were working with our partners at Southern Indiana Community Healthcare, that transportation and things like that can be a bit of a barrier for these women. And so providing a marathon card was helpful to be able to kind of address that barrier while also having an option for women who live throughout the entire area. And that's why we kind of went with the marathon card. But they have a choice of which one they can get at each of their appointments. So if they want a marathon card, they can get that. They want a CVS, they can get that. They don't have to get the same one every time. And that's kind of where our incentives play in. Again, just as a reminder from the previous slide, they have the potential of having this intervention at up to 19 visits. So the 12 during pregnancy, up to 7 after the baby is born. So they're potentially up to 19 times where our participants can earn a $25 gift card if their carbon monoxide level is lower. And as I mentioned before, this is a collaboration between us and the clinics down in Southern Indiana. And just to kind of show how our responsibilities are a little bit different and how we work together on this. So SICHC is really responsible for implementing the intervention. So they recruit the participants when they come in for their initial visit to establish pregnancy. They do the informed consent process and the HIPAA waiver collection, and also they implement the baseline survey in the enrollment, and then they use the smoke-alizers at all of the different points of the intervention and monitor those CO levels. So they're also responsible for distributing the gift cards if the women are able to earn those during their visit. And in that case, it's a lot of training that these team members have had to go through to be able to implement this. And on the IU School of Public Health side, we really do more of the kind of project oversight and management. I'll order the gift cards, make sure they have those, all the paperwork that they need to enroll people. This is a research study that had to have IRB or human subject approval, so managing that. And then we'll also be looking at the data collection and analysis as well. We meet regularly with our team down in Paoli and or over Zoom during COVID, like most people. And so we have a really great ongoing relationship, and it's been a really successful implementation so far. And just to show you a little bit, we are in our second year of this project, so it's still ongoing, but I wanted to show you just at least a little bit of some results that we have looked at so far from the first year. So the first year started in August 2019 and went through August of 2020. The first few months of that was basically just planning, getting all of the staff members trained, figuring out the best way that we could implement this intervention in their clinics the easiest way possible, And it took a few months for us to all work together to do that. It was really helpful for us on the IU side to hear what barriers they might experience while they're trying to implement the project. And we were able to kind of fix those as we went along, and we still kind of fix things if we need to fix those along the way. But the project began recruitment in November of 2019 is when we got our first participant. Overall, over the 2 years, our enrollment goal is really around 60 total women. This number was based on just kind of previous numbers in the past that Southern Indiana Community Healthcare have experienced, and thought that this is a number that could be reached during that 2-year time frame. In the first year, we were able to enroll 31 women, so staying right in line with our the goal that we had for at least 30 in the first year. As I mentioned, our project is still ongoing, so now we're closer to around the 45 women enrollment mark, which is great. But what I'm going to show you moving forward is really just based on these first 31 women who were recruited during that first year. So we had 31 women enrolled and completed their baseline surveys. We started with maybe a crew of around 5 staff members from SICHC when we started implementing this project. That soon became up to 16. So now we have 16 personnel there trained to implement this intervention, which is great, including some traveling nurses. And that's how we're able to reach the Shoals and Salem location as well. So this has really been, has expanded throughout the clinic staff as well. In the first year, we saw 156 total visits, so prenatal and well baby visits together. And we had 103 gift cards that were distributed. We actually saw that most women, I think it was all except maybe one, had always earned a gift card on their following attempts. So their CO levels were getting lower. At least they did at least one time throughout all of their visits. So the gift cards have definitely been going, and that's a great thing to always have to supply more with that. Just some basic results from the baseline survey so you get a better idea of what our participants kind of look like. Our average baseline carbon monoxide level is usually around 12. Sorry about that. My dog is going to probably bark. But that has ranged from 0 to up to 37. So that's our highest CO level that we had. But again, average is around 12, which is still considered a heavy smoker. And so the average age is 25, and that range anywhere from 21 to 38 years old. The income tends to be less than $35,000. Most education is high school or GED. The time to first cigarette is about between 6 and 30 minutes of waking up. So it shows some higher dependency on nicotine. And out of their 5 closest friends, on average, 3.5 of their friends out of their 5 closest friends also smoke. So it's something that we are able to kind of look and see what their environment might be like. Also, out of those 31 participants, 24 had a partner who also smoked cigarettes. And again, that's just another way that we are looking to see what their environment, immediate environment might look like. So there are some multiple strategies that we asked about in our baseline survey about what might help them quit smoking. And some of those, we talk about having a quit buddy. So maybe it's having their significant other or spouse or another family member also try to quit with them. And then we see that that was kind of at the lowest of these strategies, but still scored 5.14 out of 7. So still pretty high. And getting a reward was at about 5.3 out of 7. And then seeing their personal carbon monoxide levels, 6.07 And the highest strategy was seeing my baby's carbon monoxide levels at 6.5 out of 7. So one great thing about the Smokalyzer, when the women complete that and they blow into that, they get a CO level for themselves, but then you can also see the amount of CO in their baby's body as well. And so that's something that, as we'll talk about a little bit later, has been pretty impactful and looks like it's a good strategy based on our baseline survey results. And this is a graph just to show kind of the average CO levels at the prenatal visits. So it goes up and down a little bit, but you can see at the baseline, it starts around 12. It has gone up and down. So these are kind of what we're watching along the way. This is from the first year, what we've seen so far. This will be interesting to continue to see, kind of test these differences for significance. But right now, this is what I'm able to show. So for the prenatal visits, also, this is the same graph, but this is for the well baby visits. So these are for the visits after the baby is born. During the first year, we had we had people get all the way through the 4th well baby visit. Again, that it could be more as more people stay in longer. We'll be able to get a better picture down the road with all of the, like, up to 7 visits, but this is from the first year what people were able to get through. And you can see that there's a pretty stark decrease in terms of the first well baby visit to that 4th well baby visit. One thing you might notice from the previous slide is that the CO level is around 10 here, but then the average is up around 20 at the first well baby visit. And so that's something that we are looking at as well, because there's some research out there to support that within 3 or 6 months, women are smoking again, even if they did quit during their pregnancy. So this is something we're able to take a look at as well. And I did want to share a few qualitative experiences, either from our participants or from our staff who are implementing this. And so the first one, it says several patients have seemed surprised and have been made more aware of their CO level readings and range. For them to be able to see the numbers on the Smokalyzer machine has been good. Some have even cried when they saw their reading. So again, this has been a really impactful thing where they're able to see the carbon monoxide levels, not just for themselves, but in their baby's body as well, has been a really important part of this experience, helping women to quit or decrease their smoking. We also get some kind of feedback when it comes to their experiences just with smoking in general. So some will say, I'm going to do better next time if maybe they didn't earn a gift card at that visit. Some have said, this program is great, I can really use the gift cards. So it seems that the gift cards have been a good choice as well. We're also seeing, and I'll talk about this a little bit later, that sometimes the women don't participate in every session, which they don't have to. If they want to decline to participate at their appointments, they can. So some people will say why they're doing that. So they'll say things like, I don't want to participate today because I've been very stressed, and they just know that they've been smoking more. And then a little bit more about that social environment. I live with a lot of people who smoke and can't get away from it. So all of these are important for us to know as we kind of look at this intervention and see how we might be able to tweak it down the road. I think this was a good, from our staff expectations here. We were able to, again, we have been working collaboratively with SICHC since the very beginning of this project. They've helped us make all the decisions along the way. And so this kind of reflected from the staff side. And they said, starting the OB Quit Smoking program took a lot of teamwork and good communication with both teams. They had to learn our office processes And then SICHC learned about our vision for the study and a little bit more, the first year we were able to get 31 pregnant women enrolled in the study. Many of these decreased or quit smoking during pregnancy and were delighted to get a $25 gift card when they saw their CO level go down at each visit. That's a success. And so I think that's just a really good quote for both sides of us and our collaboration. It really has been a lot of teamwork, and the staff at SICHC, we wouldn't be able to do this without them. So we're glad that they are feeling it as successful as we are at IU. So just a brief, as we all know at this point, COVID has really had an impact on everything that we've been doing. This study was not immune to that. So when COVID hit, a couple of things had to kind of be changed around in our original study plan. One thing that this staff had to do at SICHC, and they actually had created an additional location that they were serving their pregnant women. So they are not at the main Paoli clinic. They had a Cherry Street location that they were starting to serve the pregnant women who came in. And they were also not allowed to bring anybody in with them or to have anybody accompany them during those appointments. And that was problematic because in the second year, what we really wanted to do was bring in enroll women who will also have a support person or a family member or a spouse who also smokes to kind of be their quit buddy and also incentivize them and see if that would make a difference. Unfortunately, we kind of had to put that on hold for the moment during COVID because women could not have anybody accompany them at their appointments. Also, as one of those quotes kind of related to, we've actually seen an increase in participants who are declining their CO level reading at appointments, just mostly citing stress and that they know that they've been extra stressed during this time and they've been smoking more during this time. So those are some challenges that we are seeing kind of ongoing and that impacts from COVID as well. So moving forward, again, this is an ongoing project that will go through at least August of this year. After that, we will be taking a deeper look into the data analysis part of this and seeing the intervention and the results among the women enrolled in the study. And we're also going to take a closer look at the analysis of just the implementation part of this program. We were able to do this in a primary care clinic. It wasn't a hospital. It's a federally qualified health center. So just looking at implementing this in a different kind of setting is something that we're going to be taking a look at as well. Maybe doing some qualitative interviews and things like that. Also, what I mentioned before, the incorporation of a support person or family member, that is one thing we initially wanted to do with this study. Hopefully, this is something, an intervention that could be tried in the future or a way to improve or test some different strategies as well, in addition to the financial incentive part of the intervention. Other than that, I think that's a great overview of how we've kind of implemented this. Again, my name is Christina Hunter-Mullis. There's my email address. My advisor, Dr. John Macy, his email address is there as well. If you have any questions, feel free to reach out, or I can take any questions that you might have now.
Thank you so much, Christina. I haven't had any questions come in yet, but I will encourage everyone on the line. We did get one comment that it was super interesting, and we appreciate you sharing. But if anybody has any questions at this time, please use the chat or Q&A function. Or if you would prefer to ask your question verbally, you can use the raise hand function, and we can give you the ability to ask your question verbally. If you don't know how to access those items, you simply hover your mouse at the top or bottom of the screen, depending on which view mode you're in. And we'll go ahead and keep the line open for just a few more minutes here if anybody wants to submit a question. So we did have a question come in. The person said, maybe I missed it, but are you incentivizing family members too, or could you?
Yeah, so currently we're not doing that. This was something that we wanted to put in our second year of the grant, but because of COVID and things like that, and not being able for have that family member coming in to their appointments, is something that we just kind of had to put on hold because we weren't able to kind of make that work within the implementation that we had currently, which is just at the women's appointments. And so we considered this, consider ways of maybe being able to do this, but none of them really seemed that they were really doable because it was the winter time. We couldn't just have like people sitting in their cars or things like that. And so this is definitely something that could be done, and hopefully we'll be able to do that at some point. But as of now, we are not incentivizing family members to.
Okay, well, I don't see any other questions that have come in. Totally agree with her commenter. Very, very interesting program. Definitely will look forward to hearing what you come up with in year 2 as well. And if you are able to implement some of the smoking buddy or family members in the future, or quit buddy, not smoking buddy, quit buddy in the future, I think that would be very, very interesting as well. But
Yes, I agree. Thank you.
yeah. Okay, well, thank you so much, Christina, for your time today, and thank you to all of our attendees for joining us. Again, this will be archived to our YouTube channel later this week, so please come back and share with any interested parties you think might want to learn more. Thank you, everyone.
Thank you.